Hello again, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Let's face it, a lot of low back pain is a result of some kind of a structural weakness or failure. And if leg or foot asymmetries or misalignments exist, you have abnormal forces that interfere with your spinal function, and this can contribute to health concerns along the chain, which goes all the way from your feet to your knees, all the way up into your low back, up to your neck, and it can affect the generalized condition of your back and lead to things like back pain. So one way to reduce back pain and check this, make sure this is not a problem, is to use some orthotic supports along with spinal chiropractic spinal adjustments. So you can have a lot of issues with the feet that will contribute to back pain, like collapsing of your arches, flattening of your feet. That's called excessive pronation. Basically what's happening is you're turning the sole of your foot outwards, and that leads to collapsing of your arches. So your ankle bends in and the sole of your foot bends outwards, and that puts a lot of torque and rotational stresses on the leg, the hip, the pelvis, and also your low back. And then if that goes on long enough, eventually your ligaments can get very lax and unstable, and that can translate stress all the way up to your back, your lumbar spine. That's your low back, mid back, all the way up to the neck. So these forces can be decreased significantly if you have proper alignment and bracing of your feet with orthotics. Also, degeneration basically in the lumbar discs and the joints between the vertebrae. If your heel, for example, is hitting the ground too hard, that can aggravate and shock the low back, leading to low back pain. And you can easily reduce that force by having shock-absorbing shoe inserts or orthotics that dampen that shock. And the effects are often drastic, really dramatic with that. Also, you can have an anatomical difference in your leg length. This produces abnormal strains on the structure of your pelvis, your hips, your low back, and that can cause chronic pain, and also can cause degeneration after a while. So this is where one leg is actually appears shorter than the other, and due to misalignments, and then that can be corrected with lifts and orthotics. So that's another good reason to get your feet checked and make sure that you have some orthotic braces. So some questions you can ask yourself to see if you need orthotics, or ask somebody else, a family member or friend that you see is having some problems with their back or with walking, or do you stand or walk on hard surfaces for more than 4 hours a day? Have you had prior injury to your knees, your back, or your neck? That can also be another red flag. Do your shoes wear unevenly? Are the soles worn down more on one side than the other, or on one foot than the other? Do you have joint pain while you're standing up, walking, or running? Is one of your legs shorter than the other? Do you have any obvious foot problems? Do you have bunions, for example, corns, flat feet? Do your feet toe out when you're walking? Are your toes facing out more than normal when you're walking? So if you have a yes answer to any of these questions above, then you may be a great candidate for some orthotics and getting your feet checked at least, and see if you need orthotics. That's one thing we do here in our office at New Hope Chiropractic. So it'd be a good idea to contact us and get in and have your feet checked for misalignments, and see if you're a good candidate for orthotics. Check us out at newhopechiropractic.com, and in the meantime, happy walking.